Hi there, I'm Mabel Jung, and you're watching the World Healthcare Congress Interview Zone, and I'm very pleased to have Bill Woodson here. He is Senior VP at Sg2, and he specializes in healthcare strategy. Bill, it's great to see you.
Thank you very much.
I was intrigued by the title of your presentation, Looking for Growth in All the Wrong Places. Now, people are certainly looking for growth, and more importantly, maybe looking for security. If they're looking in the wrong places, they ought to know about that.
Yeah, I think it's a mindset, and our customers are health systems from across the country. We work with about 1,200 of them, and it's a very uncertain time for them. And their traditional model for running their business has been to chase transactions and procedures. And our message to them is that's not the right way to think about the future. And the questions they should be asking is, what's your product? How good is it? And how is it meeting the needs of a specific population of patients? So rather than how many people can you bring through the door for a specific type of care, it's what are their needs and how do you help the patients get through their patient journey at the best combination of cost and quality that you can deliver.
And if they're checking off the no box and for a lot of these questions that you're asking, is the writing on the wall for them?
I think so. So for some health systems, they're either not there yet or they're resisting the change. I think other health systems have started to embrace it, but making the transition is extremely difficult. And the reason is they're still paid for volume for the most part, but a percentage of their business is now forcing them to respond to the mandate to reduce costs and improve quality in healthcare. It's as much a cultural journey as it is a change in the business model.
Now, how agile do you think a lot of these companies are out there looking for transactions, really how agile and able are they to be able to pivot and change their methodology and
I think
systems?
it's the real angst and lament of what's out there, and they realize they can't change quickly. These are complex organizations, matrix models, and their nurses and doctors have been doing things a certain way for their whole careers, and now the message is, that was fine, but please now do it completely differently. So putting in the right organizational structure and the right leadership model for pulling that off is the challenge. The right leadership model is much more driven by physicians than it's ever been. So those providers that have the best physician leaders to lead this change are going to be in the best shape.
And really, it will be driven a lot by the consumer, the patient.
Hopefully. So their new economic incentives and their knowledge about the type of healthcare they want, living with chronic conditions, survivors of cancer care, I think the patient's going to come to the table a lot more than they ever have before.
Let's talk about the patient a little more. What do you think the growth rates are going to be like nationally for the different types of patients we're going to see in this system?
Yeah, it's the right question. So we do forecasting over a 5 and 10 year time frame, but in 10 years we see inpatient demand declining by 4 to 10%, depending on the market. A lot of that decline is on the side of medical cardiology and general medicine. And then on the outpatient side, the ambulatory side, double digit, 15, 20% growth in almost every clinical area. So the takeaway from that is we've built health systems very much focused on hospitals. The future is very much focused on ambulatory organizations.
And payment, reimbursement for the fees that are going forward, how will this, the evolving nature of how that's executed, how will that impact the healthcare system?
Yeah, I think this is a fundamental shift, and it means that the economic incentives that everyone's worked under are going to be inverted, and the question will no longer be how many more can we do to get more cash or more dollars. It's how are we delivering back a portfolio of clinical services that's delivering care in the right setting for the patients and the payers to meet their needs. And it's a kind of redesigning the care journey for the patient that's going to make the difference.
And your final word on where your best advice on this growth issue. What do you want all involved to know about where this is going to lie, the growth, the survivability of some of these organizations?
Right. You know, I think there's a couple of messages here, and one is that, you know, hospitals and health systems, they're indispensable, we're going to need them, but they're going to have to change the way that they provide care. They can no longer think of themselves as the center of the universe. I think there are hospitals across the country that are going to become much more commodities, and the shift in the health system goes towards the physician and ambulatory side. So the takeaways are outpatient, outpatient, outpatient. Health systems need to come up with a new way of working with physicians, need to focus on care transitions, and acknowledge that there's some smart growth choices and some not so smart growth choices that are going to be out there.
Okay. Bill Woodson, a pleasure to see you today.
Thank you very much.
Thank you so much. And I'm Mabel Jung. Thanks for watching.